So I still see some people moving into their rooms, but I want to, in the interest of time, make sure that we have enough time to share out and have a discussion. I know that this group might be smaller than some of the others, but just as a heads up, this is the Cervix group. So if you were intending to be here, awesome, you're in the right place. But if you need to relocate, then let us know, or you should be able to shift your breakout room assignment down below. But in the interest of time, I would love to get us started. My name is Jane. I am the program manager for cervical cancer screening at the American Cancer Society. So it's lovely to be here today. Thank you for having me. And I'm going to be your meeting facilitator today. So we have two presenters today who are going to walk us through more about what they've done at their own particular health system. And then I have a couple of guiding questions that hopefully we can get to. If you have questions, feel free to throw them in the chat. If we are not able to get to your question in today's breakout session, we will go back and answer them and follow up. So that is the best way to do it. We are a bit of a smaller group, it appears, so we might be able to have a little bit more back and forth discussion. So without further ado, we have Jonathan Boggs joining us. And so I would love for Jonathan to introduce yourself further, introduce your system, and maybe just kick us off with some of the work that you have been doing related to cervical cancer screening in today's conversation. So thanks for being here today, Jonathan.
Thank you, Jane. My name is Jonathan Boggs. I'm the program coordinator for Appalachian Regional Healthcare. We have 4 facilities that are in this project, and we are located in rural eastern Kentucky in the Appalachian Mountains. So we chose breast and cervical, but we are doing a women's health campaign. That's what we chose to do. And, because we already have lung and colon programs in our facilities, and we saw that we had a big drop in breast and cervix screening. So that's the reason we chose those 2. And like I said, we're utilizing a women's health campaign to do that.
Thank you for giving that overview. And can you talk a little bit more about this women's health campaign? Like, what is incorporated within that? What specifically are you doing to within that campaign?
So, because of COVID, a lot of people, don't take care of themselves and they've took care of others and still have taken care of themselves. So that's kind of our slogan or push behind the campaign is love yourself first, take care of you first so you can take care of others. And so we've been doing weekly virtual webinars, especially this month with OBGYN specialist and OBGYN oncologist. Done a webinar 2 weeks ago. We've done another one this week. And then we've also utilized our physician liaison team that's been going out to the providers' offices in the communities to reassure the doctors, get the importance of getting their patients in to get screened. We've also done a big push to our internal staff, just not, everybody thinks of the community, but our staff that's in the hospital is our patients as well. So we've been doing a big push to them, especially since a lot of those have forgotten to take care of themselves. They've been taking care, the nursing staff, lab staff has been taking care of the COVID patients. And we've been utilizing social media as much as possible, doing monthly pushes to, on our Facebook pages.
Fantastic. I'm definitely seeing different, from what Meg was talking about with the different columns and seeing interventions across those different columns. I'm definitely hearing a bit about provider education and patient education, as well as small media pushes. So thank you for sharing all of that. That's really helpful to see what this looks like in practice, those different areas. I would love, Jonathan, if you could tell me more about what interventions have you found to maybe be the most effective within your own health system. And then on the other side, if there's others too that you've tried and maybe were not as effective, if you could go into that, that would be really helpful.
So I would say that utilizing the physician liaison team has been the biggest help, going out to the community providers and, stressing the importance of screenings. And I would say that the biggest challenge, it would be the social media. We live in rural Appalachia. Not everyone has a computer. Not everyone has a smartphone. We don't have good broadband. So that's been probably the biggest challenge, is to get to people that really needs to see it. And especially because we can't go out and do community in-person events at this time.
Great, thank you for sharing. And so I would love to know too, between the time that you started implementing these interventions, particularly this physician liaison team, maybe starting your social media posts or doing some of that patient education, even within your own health system, because you mentioned that the staff there too are also the people who are being served by your health system. About how long from that time of when you started doing these interventions to when you saw changes in your screening rates?
We started when the project, when you all announced this project, that's when we started putting together work groups to start implementing these. We did at first see a little increase in screenings, but since the new spike of COVID in the last couple of months, those screenings have went back down again. I think people are just scared to come out. So, we've been trying to push that it is safe to come in. So, that's kind of our focus now, is to try to, let the public know that it is safe to come into our hospitals and clinics.
And so with this, like as you mentioned, this new bump in COVID, and really wanting to emphasize the point that it is still safe to come in and still really important to come in and get your screening, is that some messaging that you're pushing out through your physician liaison team and in these webinars that you're hosting, as well as through your social media posts? Is that kind of the main theme that you're seeing in that messaging?
Yes.
Awesome. Great. And then I know that you briefly touched on this, but I would love to dive into this further. I know that we're constantly talking about COVID's impact on screening rates. And in particular, let's focus it into cervical cancer screening rates for this conversation. So what have been the greatest barriers to getting your community screened and implementing these interventions in your community? You can talk about COVID being one of those barriers, but I would love to also know if there's other barriers. I know you mentioned internet access and not being able to host your in-person patient events, but if there's any other challenges that you'd like to talk about and how you navigated those, that would be really helpful for the group.
So another big challenge has been health literacy, because rural Appalachia is not a very well-educated area of the United States or of Kentucky. So health literacy has been a big challenge as well. So we, with signage and our social media posts, we try to put everything in simple terms. That way people can understand more of what's going on. Even with our webinars that we've been doing, we tell our presenters to, try to not talk so medically, and put terms more in the way people understand from our area. So health literacy is a big barrier.
Great. Thank you so much for giving that overview of what you're doing and how you're doing different interventions from all across the spectrum and what these look like in practice. So you're touching on provider education, you're touching on patient education, you're touching on this small media post. So I hope for the group that this is helpful to kind of see what this looks like in action. And so because we are a smaller group and we do have some time, if anyone wants to come off mute and ask Jonathan any questions that they have about his system or cervical cancer screening rates or their interventions that they have deployed, you're welcome to. So I'm going to take a pause and check the chat, as well as see if anyone has any questions. Okay, I'm seeing no questions. So I would love to ask a little bit more too about some other things. So I'm going to go ahead and ask some questions. If anyone has questions, feel free to jump in the chat, feel free to come off mute, feel free to raise your hand. So Jonathan, when we're looking at the different columns that we have, so we have our 3 different columns that Meg was presenting on here today, which is increased community demand, increased provider delivery, and increased community access. So we have definitely have some of your interventions falling in this community demand with our small media, as well as patient education, and then also in the provider delivery column with the physician liaison teams going out. Specifically in that increasing community demand by helping to reduce barriers. Is there any work that your team is doing around there, or is there stuff that you want to do that you are hoping to do in the future?
Well, I can tell you some good news that has come out of this project. I actually just found this out about a month ago. By doing this project, we have started a patient assistance fund just for women's health. We've always had a patient assistance fund for our cancer oncology patients, but this is new to us. So now they're doing fundraising, and corporate office is setting money aside just for women's health to help with copay assistance. If a patient doesn't have gas money to get to an appointment to do their screening, that is available to them. Also, where we are, we don't have, let's say, a woman does come out to have cervical cancers. None of our oncologists are not specialized in GYN and in oncology. So we have to refer them to a university hospital, and that is sometimes it's 4 hours away for some of our facilities. So those patients are going to need hotel assistance. So, we'll pay for their hotel stay, if they need that. And then also if some of them have copay assistance, that funds will also help pay for that. But that's been the big success of this project for us, is to be able to offer this to our patients.
Yeah, that sounds incredible. That's an amazing accomplishment that's also come out of this. In addition to implementing these interventions and getting those screening rates up, the fact that there's another established and sustainable way to continue to provide care for women and increasing access to care is huge. So that's a major win, and congratulations on that. So I would love to know too, if I don't see any questions yet in the chat, so I'm just going to keep going. But you mentioned that this is a result of this project. Can you talk to me more about maybe how this came about? Was this something that people who were working on this really expressed that this was a need, or how did that come about?
So it's actually our physician liaison team that got the feedback from the community providers that they were not getting, patients were agreeing to go, but they just had no way to get there. So that's when our liaison team and our marketing team got together with our corporate leadership, and they made the decision to establish this assistance fund.
That's great. That's awesome that your other parts of your intervention are weaving into other interventions and really helping to drive these screening rates up. And I'm excited to hopefully see progress too, like once this fund really gets up and running, how that also impacts your cervical cancer screening rates. And I'm imagining that since it's a women's health fund, it might also cover breast cancer screening related charges. So it'll be great to see how both breast and cervical rates potentially are impacted by this. So thank you for sharing that. We do have a question in the chat, so I'm going to read it. And Megan, feel free to come off of mute if you would like to elaborate on this, but I see you coming off of mute, so go ahead.
Yeah, so for our facility, we've seen a dramatic increase in COVID. I'm not sure if that's similar for you guys just in the past month or two. So I have a feeling, I haven't checked our numbers yet, but I have a feeling we're going to see a decrease in decrease in screenings. Our interventions we've used is actually providing medical staff with a new database so that patients without a provider can be screened. So we're identifying those within our Epic system, which is great. And then we've also used small media, social media. And those are the two interventions that we have done. And we actually have seen an increase. It's been pretty apparent looking at our data that with the vaccinations and, well, back in June and July, we saw lower COVID rates, but August, September, we've seen an increase. So I have a feeling that in the next few months, our rates are going to go down. And I just was curious, it's going to be, our team is pretty much at capacity in terms of implementing new interventions. And if is it okay? Because my thought is what we'll do is continue to do some small media on our Facebook page, Instagram page. Is it okay if we use the same intervention, or do we need to use new interventions?
That's a great question. And I think that's something that others are probably wondering as well. What I'm going to recommend that you do is, for clarity around specific interventions and documenting them and some of the requirements for this work, I recommend reaching out to your COC contact for that particular kind of information. I did write your question down though, and so we can follow up with you on that particular question as well. But I think it's a great comment. And if anyone wants to comment too on, with this spike in COVID and with the increase in COVID, how their interventions are shifting, that would be, I welcome that. So I just want to warn you, we have a minute until we get a notice that says we have a minute to get back to the breakout room. So if anyone has some last minute thoughts that they want to add, you are more than welcome to. But Megan, I can follow up with that question. But at the end of the day, I do recommend reaching out to your Commission on Cancer contact regarding interventions for this work.
Thank you so much.
Mm-hmm. So I'm not seeing anything, but what I would just like to do before we get the final notice that we are heading back into the room, I would just like to thank Jonathan for being here today, for sharing what your system is doing and the amazing work that you have going on. It's really quite incredible to see the transition of these are the interventions that you started and how they continue to morph and develop to hopefully improve cervical cancer screening rates and also breast cancer screening rates in your system. So thank you, Jonathan, for your time today and for sharing.
Yeah, thank you for this opportunity to talk with everyone.
Of course.